to clarify that it's not a crime to wear a mask?
I have no idea. I don't know. I guess it was just important to get that out there.
Hopefully nobody asks about that. I feel like it's been long enough, we should know that.
Yeah. We are officially live. So right now there's only 4 people in attendance. So I'm going to give them another minute. They might just be hopping on. Because otherwise this would be a really quick town hall. All right, it's 2:01. Do you guys want to go ahead and get started? Cool. All right, you guys. So at this time, I would like to welcome those who have registered for today's Blue Ridge Health District COVID-19 Town Hall, along with those who have tuned in to view the live stream on Boxcast or our social media channels. My name is Lasheen Parks, and I'm with the city's communications office. We're hosting this Zoom webinar, and I'll be moderating today's Q&A between our panelists and the community. Just a few notes before I hand it over to Jason Elliott, the Blue Ridge Health District's Deputy Public Information Officer. After the presentation, we will give our registered attendees an opportunity to ask the panel questions. You may do so by using the raise hand icon on your screen or pressing *9 if you're on a telephone. At that time, we'll start off with the first round of questions, limited to 1 question and 1 follow-up. If the time permits, we will proceed to a second round of questions. As always, keep your questions respectful and thoughtful for all of our participants. We appreciate your participation, and with that, I'll hand it over to Jason Elliott.
Thanks, Lasheen, and thank all of you for being here with us today. As you've heard, my name is Jason Elliott, the Public Information Officer for the Blue Ridge Health District, and we'd like to welcome you to today's town hall. We're joined by a panel today to talk about some vaccine efforts and give you some great updates about all of our initiatives for getting those vaccines out into the community. We are joined today by Ryan McKay, the Blue Ridge Health District's Incident Commander, the Blue Ridge Health District's Director of Partnerships and Strategic Initiatives, Rebecca Schmidt, our BRHD Project Manager, Jen Fleisher, and from the City of Charlottesville's Fire Department, Emily Pelliccia. Today, we're going to talk about our vaccine updates for data. We're going to talk about our mobile unit, and then we'll move into talking about homebound vaccines and wrap up with questions from you, the viewers. And with that, we'll pass this on to Ryan McKay to talk about data and our JCPenney vaccine site.
Thank you. If we could get the slides up. All right. So just again, my name is Ryan McKay, Incident Commander for the Blue Ridge Health District for COVID operations. And as Jason mentioned, we're going to go through a couple of different things today. Sort of one, obviously talking about our data, but then wrapping up what we've been doing at JCPenney and sort of the steps forward for what we're going to be doing as a fixed location in Charlottesville, Albemarle. And then Jen, Emily, Rebecca will talk a little bit more about the mobile pieces. So first, looking here at our data, since December, there have been 272,986 doses administered in the health district. This includes all of the doses administered by primary care providers, pharmacies, our partners through UVA Health, what's been administered to healthcare workers, including Centera's health system. So this is cumulative for all of that. What it may not include is some of the federal doses that have been administered through federal programs and agencies through those departments. We've made great progress over the course of the last 6 months. As a district, some of our localities have more than 70% of adults with at least their first dose. And as a district, we're nearing that number of 70%. As a district, which is really important. Remember the goal being 70% by July 4th as a state. We're confident that we're heading in the right direction. We may not get to 70 in all of our localities, but we're well on our way. Next slide. So we are transitioning out of our JCPenney vaccination site, as we've mentioned, and it's been heard in other forums. We're certainly appreciative of Mr. Richard Hewitt, who owns the space and has allowed us to, through Albemarle County, lease that space for the last couple of months to be able to provide a mass vaccination site along with what UVA Health has been doing at Seminole Square. It's been really critical in terms of providing vaccines. As you can see, we've provided 34,495 doses since March 23rd. But what we've been finding over the last several weeks is diminishing demand for first dose appointments. And so that to us signaled this idea that we need to change from larger mass vaccination sites to either smaller locations or, and what we'll talk about here shortly, are the mobile efforts needed to conduct outreach, to get people to overcome hesitancy, and to really meet where people are to provide them with more or easier access to the vaccine. We are relocating to a smaller location within Fashion Square Mall. It's the old J. Crew site where we will provide access to the vaccine 4 days a week. Our hours are going to shift a little bit, so we'll continue to do Monday evenings, but we're also adding a Thursday evening hours of operation to provide people with opportunities to come in at a different time of day if that's been a barrier to others. So we'll be here for the foreseeable future. We'll offer a vaccine as long as demand warrants the use of those resources. But again, we're taking some of our resources we used at the mass vaccination site and shifting towards those mobile operations, which is where I will transition things over to Rebecca to talk about the mobile unit.
Good afternoon. Thanks for being here. So we, like many local public health departments across the country, have been really interested in mobile health, along with all of our partners in fire and EMS and with our health systems. And COVID provided an opportunity to work with partners to invest in mobile health, and not just for vaccination, although that's what we're starting with, but hopefully with partnerships with many of the organizations you see on the call, and also with new partners across our district. So thanks to the Jean Ann Foundation, an anonymous donor, and Albemarle County, we were able to purchase a mobile unit that you can see here in the picture, but can also see certainly on our website and in flyers that we're distributing across our community. We launched it last Tuesday, June 8th, and we were at Loaves and Fishes Food Pantry the day after to vaccinate people. And so in the last couple of weeks, we vaccinated over 50 people at multiple locations across the district, and are really focusing on areas with lower vaccination, and also areas that are just being community groups, employers, et cetera, that we're reaching out to or are reaching out to us. And we certainly encourage you to do that if you have a business with employees who still haven't been vaccinated and might have some challenges getting to one of our fixed sites. Churches, if you're housing community, any of those places, we would be more than happy to partner and see if we can work into the schedule. We're really excited to be places that we haven't been before, like farmers markets and county fairs and other places, and really to have a presence in neighborhoods across our district with this unit. Again, like I started with, we're planning an expansion of services, both health department services, like our rapid HIV and hepatitis C testing, and then also through MOUs with other providers in our district. We really see this unit as one of what we hope to be a fleet of vehicles managed by lots of different organizations, including Charlottesville Fire, UVA Health, and many others that can really bring services across our district. So with that, I'll turn it over to Jen and Emily to highlight another of our vaccination programs.
Thanks, Rebecca. Hi, I'm Jen Fleischer, and I'm assisting the vaccination effort through BRHD with Emily and, oops, I think you can hear me now, another partner, Justin Vesser from UVA Health. So Charlottesville Fire and Blue Ridge Health District and UVA Health have been providing homebound vaccines to anyone in the district with mobility, medical, access or scheduling issues and getting to a vaccination site.
Looks like Jen froze up a little bit, so I can jump in here. This started,
Okay.
Are you back? I'll just keep going. This started in March, as you can see from the slide. And so far, we've already reached over 175 residents. And essentially, we're doing this Tuesday through Friday with Pfizer and J&J vaccines available. Is Jen back? Do you want to add to that?
How?
I think she's having some technical difficulties. This was really this was really a partnership that kind of came about organically from some questions that were received, I think, both at the UVA call center as well as the Blue Ridge call center in the early stages of vaccination around some elderly residents who really just couldn't be brought to the various sites. And so knowing that we're a trusted partner in the community and people often have no problem opening up their homes to a firefighter, we jumped in, we took advantage of that and jumped in to help make this happen. And UVA was quick to offer a pharmacist or clinician that could do the actual vaccination. So we've teamed up using a city fire department vehicle and EMT driver. And the really exciting thing for us is our firefighter also does a quick kind of survey of the home and he checks for working smoke alarms and other hazards and can even install a free smoke alarm. So we sort of capitalized on that opportunity, and but it's a win-win for everybody on this one. So I think that's the kind of overview of what that unit's doing.
Great overview. Can you hear me now, Emily?
Yeah.
Oh, great. Of course. Yeah, and I'd really love mentioning that it's really an equal effort on all three parts. So the scheduling and I think this is just the beginning of this collaboration. I think we hope to continue serving not only whole families at home, but branch out, just as Rebecca was saying, into all kind of health efforts together now that we've really solidified our workflow and our connections and our relationships. So it's been pretty exciting to really know we're reaching those who otherwise would not get vaccinated.
Yeah, and I think it's also capitalized on the COVID has presented the opportunity for us to really identify those most vulnerable in ways that we couldn't have previously. And so that's just been a tremendous opportunity, I think, across the public health and public safety spectrum.
Absolutely.
Fantastic. Thank you, Emily, and thanks, Jen, for powering through internet issues today to bring us the good news of homebound vaccines. And with that, Lasheen, we can turn it over to our guests today, and all of our panelists are available for questions. And I will let you handle that since you can see it on your end for us.
Hey, Jason, and actually it looks like Justin joined us, and I don't know if we want to give Justin an opportunity to comment on the homebound efforts.
Sure, absolutely. So joining us now is Justin Vesser from UVA Health. As you just heard, UVA is the third partner in our three-pronged approach to homebound vaccines. So Justin, if you have anything you'd like to say about our homebound vaccine efforts, we'd love to hear it.
I think you all said it best, and there's nothing to add other than that this partnership and this activity is going to be ongoing, and we want to do it until everybody who has some barrier to getting out to one of the fixed locations or out to one of the mobile sites that wants a vaccine has one in their arm. And so you can self-identify, you can refer someone else, you can call either the Blue Ridge or the UVA COVID vaccine hotlines, or by email to say, hey, I want a vaccine, but I just can't get out, and we'll find a way to get there. So it's been a great partnership for us at UVA. All of our vaccinators compete to be able to try and get into these slots. They fill up really quick because it's just, it's compelling work, and we're happy to do it. And everybody believes very deeply that this mission needs to get done for the most vulnerable. So it's been a great partnership.
Fantastic. Thank you, Justin. All right, Lasheen, we'll go ahead and turn it over to you to moderate our question and answer portion of today's town hall.
Sounds good. So at this time, if you have a question you would like to ask our panelists, you can go ahead and hit the raise hand icon, or if you're on a telephone, hitting *9, and I will call on you in the order in which hands are raised. You can ask your question to our panelists. Right now, it doesn't look like anyone has raised their hand. We only have 7 registered attendees with us. Pretty sure everyone else is just watching live on our social channels and on Boxcast, but if you guys are watching via those channels and you do want to ask a question, in the link of this post that you're looking at should be the registration link if you want to hop on in and register so you can ask a question live. And we'll give you a couple of minutes to go ahead and do that.
Lasheen, I have a question.
Yeah, Emily.
I have a question. Actually, I was thinking about as Rebecca was describing the mobile effort, I was thinking about something that I wonder if people have asked, or if they might ask, and I hate to open Pandora's box here, but if the goal is to get as many people vaccinated as possible, I think I know the answer. If there's an event coming up that people are hosting, and I want to be careful to not like really go crazy here, but say there's a big some kind of event, social event coming up, is that something that they could call Blue Ridge and request the mobile unit to come? Like if they anticipate having unvaccinated people?
Yes, absolutely. And in fact, we started out the scheduling for the mobile unit by working with partners in each of our localities, reaching out to several community leaders to identify sites across the district. And then now we're opening that up, just like with Homebound. We originally started with lists we were being provided through Medicaid and others, and are now opening that up more broadly. So certainly we are interested in hearing from you if you have an event coming up, or if you're an employer. And certainly I think one of the things to bear in mind is that it's not just vaccination often our community health workers will be there too, just to talk to people, answer questions, and we would welcome the opportunity to partner.
So a small business owner that has had a challenge getting their for whatever reason, be it scheduling or whatever, they could get the unit to come. That's really cool.
So we do have one hand raised from Nick Cropper. I'm going to go ahead, Nick, and allow you to ask your question. All right, Nick, can you hear us?
Yes, I can. Can you hear me?
We can.
All right. Well, thank you so much for doing this. I think do I have a limit on how many questions I can ask? It doesn't sound like there's a lot of other.
You have one question and then one follow-up, and then we'll see if anyone else has questions. And if not, we can bring you back in for a second round.
Sure. Well, this one is more just to really make sure, but with our mobile unit, our homebound unit, that same unit, if they had a Pfizer dose, for example, will return to that home for that second dose, right? They don't have to eliminate any need of travel.
Correct. That all of the homebounds are visited twice for first and second dose, and we also offer J&J as well. So maybe only one dose needed in that round, but same for mobile vaccination. In the unit, we will return to both locations twice.
Thank you. And for my second question, full disclosure, I did get here just a couple minutes late. So you might have already talked about this. If you did, I apologize. But from what we're seeing at just our local health district level, I mean, what are really the hangups when we are trying to push into these higher percentages of vaccinated individuals? What seem to be kind of the main hangups that we're encountering as we try to do that?
If I might take a crack at that one, and this is just from our perspective, but you know, the word hesitancy, vaccine hesitancy, is hovering over all of us right now, and I don't like the word hesitancy, especially because of what we're seeing out in the community, because hesitancy almost implies that across the board that it's an unwillingness to get vaccinated, or that people don't think it's important, or are too afraid of it to get the dose. And that's certainly true for some people, but there's an element of all the studying done about hesitancy that is not intentional like that, and that's what we refer to as constraints, and sometimes it's thought of as just convenience. And there are a lot of people who get rolled up into hesitancy that absolutely would get the vaccine, they absolutely want to get the vaccine, if only there were barriers removed for them. And so, you know, if it was there where they are, if it was there at a time and a place that was convenient to them with their busy lifestyle, or with things like being homebound, you know, being unable to travel and that kind of thing, that's still an element of hesitancy, but it's something that we can combat. So, you know, we can remove those barriers and those constraints, and by being there, a lot more people will get the vaccine in their arm. The other elements of hesitancy are tougher. You know, some people do the calculation where they're not sure if it's worth it to them, or you know, they want more time to pass, or they're more fearful of the potential harm that might come from it. And then there's another element of people who just don't know that it's worth it. They think that they've done the calculation of their risk. They think their risk is low, you know, and just want to just tough it out. And so those are tougher things that we can kind of only combat those with the passage of time, and also with making sure that we have good, reliable information that's always there in a stress-free, you know, pressure-free environment. And so a lot of what we do out in the community is just talking to people and offering that good, unbiased information. But we still think there's a lot of people out there who aren't getting it specifically because we haven't made it easy enough. And so that's what a lot of the community work is about from our perspective at UVA.
Justin, I would add to that. I think one of those convenience factors is the registration element. People were really confused initially by all of the different ways in which registration and to get a vaccine was rolled out. And so no knocks on Blue Ridge. I think that was nationally an issue everywhere. So I think it's important to note that registration is no longer really, there's no pre-registration, or you can simply go to one of these and get it very easily without worrying about the registration element.
And one thing to add on that note to what Emily's talking about registration is we do have availability for walk-ins at most of, if not all of our clinics. And so if you are interested in getting a vaccine and you haven't been able to register for an appointment, you can head to our website and see either how to register or where you can walk in. And we do have all of our vaccine clinics and mobile sites listed at blueridgehd.org.
Awesome. So no one else has raised their hand, but I'm noticing on our social live stream, someone named Marjorie, I hope I'm not butchering your name. She asked a question on how you are reaching out to some of these people who are quote unquote hesitant or who have not got the vaccine. What are your communication efforts to reach that population?
Great question, Marjorie. Rebecca, would you like to talk about some of our community health workers and some of the initiatives that we have going on to engage the community?
Sure. So I think you can look at communications in a lot of different ways, and certainly Jason can talk about the social media and the flyers and the media side of things. But on the ground, I think to Justin's point, what we've really found is that just showing up and talking to people is really where we're finding the most success. So we have 2 community health workers primarily focused on Charlottesville and Albemarle right now. We're hoping to hire additional positions in each of our communities, but they have been talking to hundreds of people and at small businesses, knocking on doors, showing up to community events and just walking around and getting people registered and talking about vaccine. And that's been really successful, I think, because they also, they take texts, they take phone calls at all hours of the day. And often what it takes is just have someone to talk to and to listen and to say, I understand your concerns, or I get that there have been barriers to vaccination. Here are the 3 ways we can get you vaccinated. And that is a lot more time intensive, certainly, but it's also been more successful. And I think what we're seeing right now is that we get really excited about 5 doses of vaccine at an event, right? That is success, and meeting people exactly where they are. If it's at the grocery store, if it's at the barber shop, if it's a church, we want to be there. And so I think that's the strategy that we want to invest in longer term, because it really is about relationship building at this point. And we're really lucky to have so many incredible partners across our district who have really led these community events in each of their communities. So we are a small part of the overall work, and I can't list all the people who have been engaged in that piece. But I think there's more to communications than that, and certainly we're looking to hopefully engage more people around radio ads and commercials and things of that nature. The local chapter of the NAACP and the Move to Health Equity Coalition have done a great job in some of that work, as have the African American Heritage Center with several local physicians. There have been a lot of ongoing efforts, and really, I think what we all agree on is in the next 6 to 9 months, our major focus needs to be on communications.
And as Rebecca mentioned, we have had, in addition to the on the ground and through community partnerships, some other communication methods to reach out to the community that have been pretty consistent, throughout the pandemic and as part of the Blue Ridge Health District's plan. We know that plenty of people have seen those PSAs and heard those PSAs because we got a lot of great feedback. So we are appreciative of that. And in addition to what we're doing with the radios and with newspapers, we do work closely with our media throughout the district, and they have been great partners with us to make sure that the community is up to date and informed about all of our vaccine efforts and all of the initiatives with the health district related to COVID. We've also had successes with using social media and with using things like newsletters. So we've been hosting these town halls. We've been using platforms like Facebook and Twitter and even Nextdoor to let our neighbors know what's happening here in the district. Each week, we also send out a newsletter to literally tens of thousands of people throughout the district to keep you posted and updated on all of our efforts, not just related to COVID-19, but also the health district as we begin to resume clinic services and what a lot of people have referred to as normal things. And so it's been a great opportunity for us to communicate with the community. And we value the feedback. So if there's something that you as a community member would like to see more or think would be helpful, you can certainly let us know. And we would love to evaluate what we can include in our communications plan moving forward.
Thank you, Jason.
I
Oh,
might
go
add
ahead.
I might add one quick thing. These are all, these tactics that we're talking about are all things that have been very helpful and very powerful at getting the word out and it helped them to give that unbiased information that people need. But if Marjorie's question might have been about what a lot of people have on their mind, that you know someone who is hesitant or who is on the fence, someone that you care about that you want to see get vaccinated, I'll also add in there that one of the most compelling and powerful tools that any of us have in helping to overcome hesitancy is for people who know other people to tell their story. And so you don't have to be a healthcare professional to say, I made the same choice that you're considering making. I'm glad I did. I got the shot. I survived. I didn't have any of the, the horrible things that you read about happen. That, along with good, evidence-based medicine information and talking to experts, you can't have one without the other, and one won't work without the other. And so, so anybody out there I think we all know someone or many people who are holding out and they're still on the fence or who are absolutely, against the idea. And so I just want to encourage everybody to tell their story if you've been vaccinated, and that will help get us closer to where we need to be.
Thank you. So if you guys do have you guys have questions that you still want to ask, now's the time to hit that raise hand icon so you can ask your questions to the panelists. I don't see any hands shooting up, dying to answer a question, to ask a question. Yeah, I don't think no one has any questions, you guys. You want to wrap it up?
Great, we can certainly do that. Thanks, Lasheen. And sometimes the best questions come at very different times. And so it's very important for anyone watching to know that if you have a question, it doesn't have to be asked in a live town hall. The health district and all of our community partners are available for questions anytime you have those. You can reach out to our Blue Ridge COVID hotline, for example, Monday through Friday, 8 to 4:30 p.m. Or as Justin mentioned, the UVA hotline is also available. You can send us an email. You can reach out to us via social media. We are here to answer your questions and to be your help through this time. With that, we'll go ahead and wrap up with big thanks to all of our panelists today: Ryan, Rebecca, and Jen from the Blue Ridge Health District, Emily from the City of Charlottesville Fire Department, and Justin from UVA Health. We really appreciate all of your efforts to get the vaccine to our community and to keep us updated about what's happening. And of course, we always want to say thanks to everyone who's on the front lines of keeping us safe, and to our community for doing your part as well. As Justin said, don't forget to tell your story, because sometimes your story is the one that will be the most impactful to the people who need to hear it. With that, we appreciate your time today, and we wish you well, and we look forward to seeing you at one of our upcoming vaccination clinics. And if not, then we'll see you for the next town hall. Thanks, everybody, and have a great afternoon.
Thank you.